Thank you, Ruby and Christabel, for inviting me here. I'm really pleased to be here to present a picture as a doctor, as a public health physician, and perhaps speak to you from that lens and ask how we, the medical profession, can be part of this movement, because you'll find that we seem to be slightly separated from some of the broader climate change movements that are springing up around us. The first thing to mention is, that our health has improved dramatically over the past 200 years. So if you look at these maps, it's a pity you can't see them very well, but if you look at these maps created by Max Fraser from Oxford University, which shows you life expectancy in 1800, 1950, and 2012, you can see that in 1800 we were pretty equal around the world. Everyone lived between about 20 and 40 years of age. And then we started to diverge, so very unequal living standards began to emerge. And so what you find in the developed world was that life expectancy grew to about 60 by 1950, and it remained at about 40 in the developing world. But the developing world is catching up. So if you look at the 2012 figures, life expectancy, for example, in India was about 68, while in Britain it was 80. And during that same period, though, the population has trebled. But the good news is that fewer people live in absolute poverty. Somebody, I think it might have been Damien, who mentioned, this particular map. We know, those of us public health academics who've been trying to track the health impacts of climate change, have actually been producing these sorts of maps. WHO started doing a map showing the burden of disease due to climate change way back about 20 years ago. But what is so unfair and unjust is that, of course, it's the developed world which has the highest carbon footprint, while it is the developing world which bears the severest burdens of the health impacts of climate change. As these two wonderful cartograms show, they're produced by University College London, and they show you all the developed countries up here looking very swollen, because that's where the carbon footprints are, and all the developing countries looking very swollen here, because that's where the health burden is. But society is now at a turning point, and as everybody, from the UN Secretary General to the Pope, tell us, climate change is the defining challenge of our age, is the biggest global threat to public health, and we all need to do something about it. One of the things that's very evident is that climate change is not a one-dimensional risk. The spectrum of risks to health is not merely wide, but almost limitless. It's unbounded. People living in diverse socioeconomic and physical conditions experience the health impacts of climate change in different ways. But in every situation, it's the poor who are the most vulnerable within and between populations. And the mental health toll is incalculable. We don't actually estimate that very well, but we know that that is almost incalculable, whether you are a climate change, you're experiencing health impacts of climate change in the developed or developing world. And it is also the case that women are disproportionately vulnerable to the effects, because of course they make up the majority of the world's poor. And as one former president of the Global Fund for Women said, it is the gender inequalities which define women's lives prior to a climate disaster, which actually make things so much worse when disaster actually strikes. So what exactly are the major health impacts? And I'm going to run you through some of the major findings reported in what's known as the Lancet Countdown report of 2018. Now, what is the Lancet Countdown? It's a collaboration of 24 academic institutions and intergovernmental institutions from around every continent. So the whole world is represented here. And what they're doing is providing, with the Lancet, the most influential medical journal hosting this collaboration, they are independently tracking progress on health and climate change across 40 indicators, telling us what the trends are in these health effects. And what are they telling us? Global warming is exacerbating existing disease and bringing on new ones, from cardiovascular disease all the way to new things we're finding out in relation to chronic kidney disease. So there is a new link established now, and an alarming rise in the link between chronic kidney disease, dehydration, and climate change. And can you be surprised at that when you see this picture of this young woman stonecutter in India working in the, possibly from dawn till dusk, at 40 plus degrees centigrade without a drinking water source or a toilet inside. And what does that remind you of in terms of the millions of other people who suffer that same plight? And just in case you think that's all, only happening in the developing countries, look at these maps. Unfortunately, you can't see them very well, but these are Met Office maps, which show us what's happened with warm spell durations right here in Britain between 1961 and 2017. And what you might have been able to see if there was a different sort of screen down here is how the deep reds, I don't know if you can see, the deep reds in the map are growing all of the time. Now, what about disasters? The climate disasters are increasing. There's a 45% increase in climate-related disasters in the past 20 years or thereabouts. 90% of all disasters are weather-related now. Asia is the most affected continent in terms of both people affected and people who are killed. Again, let's look at England. In 2007, England had witnessed its wettest summer since records began, when extreme rainfall fell over a very short period of time. And the west of the country was most affected. And perhaps some of you are from Gloucestershire and places like that, or have family there, and you will actually recall what happened 12 years ago. Who can forget this kind of image of Tewkesbury Abbey, which actually looks as if it's constructed in the middle of a lake? And the actual hard facts are even more compelling. 55,000 properties were flooded, 13 people died, probably our first climate victims in this country. Around 7,000 people were rescued from flood waters by emergency services. The country faced its largest loss of essential services since World War II. And, 500,000 people were left without mains water supply and electricity. Dam breaches were narrowly averted, transport services failed, emergency services completely incapacitated. And the cost of this was deemed to be about £3 billion. And that was right here in Britain. Weather-related disasters too, disproportionately affect women more than men. Women are 14 times more likely to die of weather-related disasters than men. In fact, in 1991, there was a cyclone in Bangladesh which killed about 140,000 people. 90% of those were women. And when somebody mentioned Hurricane Katrina, when Hurricane Katrina struck in 2005, most of the victims trapped in central New Orleans were African American women and their children, and they were the poorest population in that part of the country. Indeed, an analysis of disasters in 141 countries by London School of Economics showed that where women's rights were compromised, they died in greater numbers in a disaster. Explanations might be that women are primary caregivers, so they remain at home when disaster strikes, even if that's risky, or they go rushing off looking for dependence, even if that's risky, and cultural norms might get in the way, so they're often not taught how to swim, even if their brothers are expert swimmers. Major shifts are occurring in the patterns and distribution of vector-borne disease. And what you mean by vector-borne disease is it's also disease spread by mosquitoes. And so as their climate conditions make it more conducive for pathogens to grow in mosquitoes, you'll find these sorts of alarming statistics are beginning to show up, such as annual numbers of cases of dengue fever doubling every decade since 1990. Globally, people at risk of malaria have grown hugely. And again, that's a big risk in women because malaria remains a major cause of maternal mortality in sub-Saharan Africa. Drought-related food and water shortages, and others have talked about this, leading to severe undernutrition, population displacements, and even climate conflicts. The Lancet Countdown estimates that the number of undernourished people in the 30 most vulnerable countries has increased by about 398 million in the last 20 years. I won't say much about Cape Town, but if you go away from the vulnerable countries to very rich cities, look what happened in Cape Town. And will 2018 be remembered as the year when the first of the world's great cities ran out of water and the whole world had to reboot itself, so that this was going to be the new normal. And all of us had better get prepared for it, because there's a whole load of cities lining up behind Cape Town for this dubious distinction. And this, there's a graph here, I was going to, I'll show you anyway. But this again, what that shows is, despite the fact that 50 to 80% of the world food production is in the hands of women, it is they who suffer the most and eat the least when there's a famine. And what this shows is it's an Oxfam bar chart which shows reductions in food intake. So there's a greater reduction among older women than older men, younger women than younger men, and girl children compared with boy children when there's a major famine in a part of India in 2003. The part of India was Rajasthan. And of course, I'm the Vice Chair of WaterAid. We've got WaterAid colleagues sitting here. Nice to see you here, Charlotte. And we know in WaterAid that the other thing is women are the responsible for household water. So they're walking longer and longer distances to fetch the family's water. It's leaving less time for paid jobs and halving household income. Now, air allergens, just a word about air pollution. Weather patterns resulting from climate change associated with chest infections, asthma, allergic rhinitis, and all of those can end up causing premature deaths. Think about forest fires and the dangers of smoke inhalation and the air pollution that causes, and the prolonged pollen season that we all experience in this country, and the misery that brings. We've talked about the climate change-induced migration being triggered due to sea level rise, crop failures, reduced food and water security, and so on. And all I wanted to point out was this tragic newspaper report I saw of Kiribati. Let's spare a thought for the small island states and the fact that there are countries like Kiribati that actually have plans in place for an en masse migration to Fiji, in their case, when they become inundated, because this is not an if. They are going to become completely inundated at some stage. And climate conflict again amplifies gender inequalities as it exposes women and children to higher levels of violence in the home, and in post-disaster refugee camps, as increased reports of sexual violence post-Hurricane Katrina showed. So, I suppose as a doctor, what I feel is, could health activism be at least one of our hopes? Could it be one of those? Because if you look at all those diseases, the number of diseases that can be prevented and averted, if only we live a lifestyle which required a smaller carbon footprint is quite huge. And that doesn't even include the general sense of well-being so many of you have so eloquently spoken about. Well-being adds between 4 and 10 years to life expectancy. And that's worth remembering. Just feeling good, feeling worthwhile, feeling part of a community, feeling valued, just well-being, it does that. So there is so much in the way of health to play for. And yet what's happening is the University of Chicago tells us that 4.3 years are lost in places like India and China because of air pollution. Even in London, they claim that our life expectancy shortened by about 4 months because of our air pollution here. So, I used to be young and confused. About 35 years ago, when I started reading about this, worrying about the health impacts of climate change. And I suppose what's happening is I'm getting old and bewildered now. Because I just think the divergence between this evidence, this demonstrable impact on our health, all our health, people dying from climate change in this country, I thought that'd be the tipping point, and it wasn't. So, the divergence between that and policy direction, I think the only way is for all of us to work together. And just in case we believe actually none of that matters because it's all happening in developing countries and well, only 13 people died in this country, I just want to leave you with this example of what happens when we allow water scarcity at the kinds of global levels that is happening across the developing world and actually is going to hit us soon in this country too. When there is no water in their healthcare facilities, they use antibiotics almost as a proxy for water. And the extent of the antimicrobial resistance that we're seeing around the globe is scary. This is scary stuff. And these are the sorts of risks that we ignore at our peril. The Lancet Countdown says that there are green shoots, that the direction, I think, what did they say? They said something like, the direction of travel is set, it's in the right direction, but the mismatch between policy inertia and our concern needs to be sorted. So in conclusion, please, let's work together. Instead of climate change being the biggest global health threat, let's turn it around. So tackling climate change could be the greatest opportunity of the century to improve our health, but also to improve equity and sustainability in all aspects of our lives. So what's good for the planet is good for health. Maybe that's a message that will bring hope and make everybody an agent of change. So thank you very much.